And now we can have the adenosine running. We give it IV. Still there is no pressure drop. Ja, laat maar lopen. U kunt zo over een minuutje kunt u wat pijn op de borst gaan krijgen, ja? Dan komt het spulletje aan en dan kunt u wat pijn hebben. Dat hebben we helemaal onder controle. Op het moment dat we het infuus stoppen, dan is dat gelopen. So we are waiting for a response. We're on 20 seconds now. Dutch seconds. No, Japanese seconds. Not yet. Yeah, you can. Okay, now something is happening there. There is some. It's 97. We have to wait for 2 minutes at least. 1 minute at least, 2 minutes at most.
Ferdinand, are you not afraid that the catheter is jumping in, that you can have a dumping because of position of the...
No. The catheter is very small, it won't damp. It's more, it's the flushing which is important. So, yeah, now we are here with FFR of 96, sorry. So basically we don't need to treat this lesion.
Ferdinand, for those of us who don't do the perfusion but inject the adenosine
yes.
intracoronary, is it still possible with a 4 French?
Yes, that's possible, of course. Yeah, that's not a problem. That's not a problem. You can inject, you can flush, inject, in contrast, everything. So we can stop the infusion. We're now almost on 2 minutes, and we decide not to treat this lesion. Disappointing?
I expected.
Yeah, you expect that. Oh, great. Wow. Okay.
It's a short lesion. The lens also is important.
Yeah. It's a short lesion. Okay, I just wanted to show you this, and I understood that Dr. Saito has some more slides that he wanted to show. Thank you very much, and we go on here with case number 6. Thank you. Well, we are live again. I only have a few minutes to show you something that we have been doing here for a couple of months. We are doing FFR via 4 French diagnostic guides. Of course, I understand that you can place question marks behind the rationale, but it's important to see the feasibility and the possible limitations and what the limitations are. I know that there are circumstances where you are doing a diagnostic procedure with 4 French catheters, and then you are in doubt, is this lesion serious or not, and perhaps you don't want to change catheter because of spasm, other problems. In those situations it's nice to do an FFR. I'm going to show that today, but don't shoot at me, because when I had the coronary artery here imaged, I think already that it's a significant lesion. Still, I will do the FFR. Yesterday we did another live demonstration. I had the same impression of a right coronary artery. It was a more than 70% lesion, but the FFR was negative, so we decided not to stent. Here, this patient is a 55-year-old male patient. He had previous PCI of the CX in 2004. We cannot see where. And in 2009, PCI of the LAD was done, and of the right coronary artery. So actually, in the course of years, he had 3-vessel PCI. And for anginal complaints without typical signs of ischemia, he underwent coronary angiography in 2011, which did not reveal any significant lesions. And now the patient is predominantly complaining on shortness of breath, he's tired, fatigued, and he has pain in the back. So the complaints are not so specific. And at the stress test, which was done in May 2013, so that is some time ago, there was no ischemia. The patient underwent a diagnostic procedure not so long ago, and it showed moderate lesion in the CX, which was definitely more than it was before, and we decided that this situation was suitable to do an FFR because of the aspecific complaints and the negative stress test. But now I have made an angiogram, maybe we can show that, and the angiogram shows, well, quite an important lesion here in the CX. So I would be surprised if this FFR was negative.
We don't see the image.
Can someone show the image? The fluoroscopy is not.
Yeah, we do. Now
You
we
do? Okay, great. So I think you agree with me that this is quite an important lesion, although I think still the lumen is something about 2.5, 3, maybe 3.5 millimeter. So the catheter is still in the ostium of the coronary artery. Backup is not great. It's a 4 French. It's a 4 French system. If you look at the pressure curves, the pressure curve is quite good. But the moment that I am going to advance the FFR wire, you will see important damping of the curve, and that does not allow a proper measurement. But we have seen that that problem can be solved by meticulous flushing, removing tiny air bubbles, and then we have a proper curve again. So that's something I want to show you. The correct curve is, of course, the yellow one, which is the curve of the pressure wire itself. And now I'm going to face two problems, I think. One is that the catheter will jump out of the ostium, and the other one will be the damped pressure curve. So first I think we need to, well, this is okay. Okay, so far so good. So here we can normalize the curves. I hope you can see. Yeah, I cannot see it. So if you can move this a little bit toward the wall. Oh no, it's not possible. Okay, so you see that the red curve is under the yellow curve, but for the rest it's fine. Now I'm going to flush and prepare the 4 French catheter. Flush with water. It's already improving, you see? But still, it's not perfect. No. Okay, now we have adequate curves. We can normalize now. Yes. It's 1.0. Actually, the catheter is a little bit out of Okay.